So for those that are new to the Therapeutic Goods Advertising Framework, I will run quickly through the key legislation that you need to be aware of and where the code fits into this framework. Collectively, the Therapeutic Goods Act 1989, the Therapeutic Goods Regulations 1990, and the Therapeutic Goods Advertising Code are the legal framework for the advertising of therapeutic goods to the general public in Australia. The code is the compliance standard for advertisements for therapeutic goods. Amongst other things, the code sets out in detail the rules about what is and what is not acceptable in terms of content in a therapeutic goods advertisement, requirements for mandatory information that must be included in each therapeutic goods advertisement, and the conditions that apply to certain content and certain advertisers. The code is predominantly used by advertisers, sponsors, and sellers of therapeutic goods to understand what the requirements are and how to ensure their advertisements are compliant. The TGA can and does take enforcement action against advertisers who breach the advertising code. So why are we reviewing the code? The current version of the advertising code, which is the Therapeutic Goods Advertising Code number 2, 2018, came into effect in January 2019. It represents a major overhaul from the previous code, which was the 2015 code. The primary purpose of reviewing the 2015 code was to improve the objectivity of the provisions and the rules within the code to make it easier for advertisers to comply with the requirements, and also to make it clearer where a breach of a rule has occurred. That assists the TGA in identifying where objectively a breach of the code has occurred in advertising. The Therapeutic Goods Advertising Consultative Committee, or the TGACC, which is comprised of 24 organisations that represent advertisers, consumers, media, health professionals, industry and government, has told the TGA that some areas of the code could be improved. The TGA's own experience in administering the code has highlighted some areas that may not be working as well as intended. Moreover, in 2020, an independent review of the advertising framework, known as the Sinclair Review, also recommended that the TGA further increase the clarity and objectivity of the code. So a little bit now on our consultation process to date. Our consultations with the TGACC have been the main driver for the options proposed in the consultation paper. That said, members of the TGACC hold very divergent views on some issues, and so a broader consultation is going to be incredibly useful to the TGA in informing code improvements. So I'd now like to hand over to Graham to take you through the proposals in the paper.
Great. Thank you, Leanne, and good afternoon, everyone. We do have a lot of material to get through, and I hope that everyone has had a chance to read through the consultation paper, because obviously we can't include on our slides the level of detail that is in that paper. So if you have the paper in front of you, I think it will help you to understand what the issues and the proposals are if you can follow through this presentation with the consultation paper in front of you. So in the presentation, we are going to summarise the issues and the proposals in the same order as they're presented in the consultation paper. And we will be able to take 1 or 2 questions on each topic as we go, with the remainder of the Q&A at the end of the presentation as time permits. So we're going to start with section 4 of the code, and which includes the definitions. And we get asked about claims to some extent. Does the code apply only to therapeutic claims made about a product, or does it also cover non-therapeutic claims? Are there any claims that can be made in an advertisement that are not captured by the code? So to provide clarity on this issue, we are proposing to introduce a definition of claim into section 4. The definition will make it clear that all claims made in an advertisement for therapeutic goods are captured by the code. The main types of therapeutic claims we see in ads relate to the indications or intended purposes of the goods. And we are proposing to introduce a note in section 4 where we reproduce definitions of these terms as set out in the Act and the regulations. Importantly, we will make it clear in the proposed definition of claims that non-therapeutic claims are also subject to the code. And some examples of non-therapeutic claims would include things like leading brand, bestseller, strawberry flavour, 30% more, those types of claims. Because these types of claims are captured by the code, they must meet the general code requirement that claims made in advertisements must be truthful and not misleading. And therefore, there must be some basis to these types of claims. So to summarise, on this issue, we are seeking feedback from stakeholders as to whether proposed changes in section 4 are clear and clarify the issue around claims made in ads. So we'll just see if there are any questions about section 4. No, nothing's come through at this time, but if you have a question about section 4, please use the Q&A tool and we will be able to address that at the end. Okay, so the next issue is about section 10 of the code and concerns the lack of an express provision that prohibits advertisements from causing fear and distress. For example, when someone who, as a result of an ad, believes that they may develop a major ailment if they don't use the advertised product. And there were some examples of this in the early days of the COVID-19 pandemic, where the advertising suggested that consumers were at a greater risk of catching COVID if they didn't use the advertised product. It became clear that the existing code provisions, such as the prohibition on misleading statements, would not always prevent such statements. So the proposal in the consultation paper is to reinstate a provision from the 2015 version of the code that would strengthen section 10 and expressly prohibit in an advertisement, expressly prohibit content, in an advertisement that may cause fear or distress. So we've presented a draft provision in the consultation paper and are seeking stakeholder views on the need for such a provision. Questions?
Graham, we have a question that's come through regarding this, the wording of the proposal to reinstate. The proposal is to use the words exploit consumers' lack of knowledge. The question is, how can advertisers determine the level of consumers' lack of knowledge or health literacy in relation to the TGA's application of the code for a reasonable consumer and be able to apply this objectively?
Can I answer this one, Graham?
Yeah, I was going to throw it to you.
Thank you. So that's a really good question, and we would actually like to hear our stakeholders' thoughts on that aspect. I think the current COVID-19 pandemic highlights an area in which there is no doubt that there is consumer vulnerability and heightened concerns about, being safe and staying safe and not being infected with the virus. So that represents, I guess, a good example of where it's very easy to say that consumers could be caused fear and distress, or advertising could leverage off existing fear and distress and lack of knowledge in consumers in a way that would be inappropriate. So as I say, we would be grateful for your views on how this could be applied objectively. I think this is also a question that we will seek to write up and publish on the TGA website at a later date.
Okay, thank you. Okay, so moving on, stakeholders have raised a number of issues about the code requirements for the inclusion of mandatory statements in ads. And we are aware that this is a significant issue for advertisers. There are proposals for changes to sections 11, 12, and 13 of the code in relation to mandatory statements. And we'll now deal with each of those sections individually. Starting with section 11, we're proposing to add 1 or 2 new mandatory statements for use in advertisements. The new mandatories will be used in advertisements for products that can only be purchased in Australia by health professionals and healthcare facilities. Presently, there is only one mandatory statement prescribed by section 11, and it is required in advertisements for pharmacy-only medicines. This statement is, ask your pharmacist, they must decide if this product is right for you, and highlights the role that pharmacists have in dispensing these types of medicines. What is proposed is that section 11 is broadened and applied also for advertisements of products that are only available for purchase by health professionals or healthcare facilities. The effect of this change would be that it would exclude such advertisements from the operation of sections 12 and 13 of the code. That is, the mandatory statements currently required by sections 12 and 13 will not apply to advertisements of these types of products. Now, this change is important because the mandatory statements required by sections 12 and 13 are consumer focused and, as such, are not always sensible for products that cannot generally be directly purchased by consumers. We often talk about items for use in hospitals, such as surgical drapes or items of hospital furniture, as examples of the types of product advertisements that these new mandatory statements will be used for. And there are a number of ways the new mandatory statements can be written. A couple of examples are shown on the slide. We will, of course, still consider that online information and promotional content for these types of goods is best behind a firewall, with access limited to relevant professionals or purchasing officers. However, this approach gives suppliers some flexibility, which has been important during COVID-19. There's a second application for the proposed new statements It is proposed for advertisements that promote therapeutic goods as part of a health service delivery. The example in the consultation paper is when a medical imaging clinic is promoting its services by spruiking new medical imaging equipment. Even though the new equipment is not being promoted with a view to a sale, it is still considered to be promoting the use of the goods and thereby needs to comply with the code. Another example is a specific type of hip prosthetic that may be promoted by a clinic that specialises in hip replacement surgery. And while it's not anticipated that a consumer would be prompted by an ad to go out and purchase their own new hip, it may still lead a consumer to decide that they need a particular type or brand of hip prosthesis. As such, this type of promotion is also considered advertising and must comply with the code. So the new mandatory statements will be used to alert consumers that they cannot necessarily be able to purchase the hip implants themselves, but they should discuss with their health professional whether this type of hip implant would be a suitable option for them. For clarity, the inclusion of this mandatory statement will not exempt the need for advertisements to comply with the consumer advertising requirements prescribed in the Act and the Code. For example, the consumer advertising for a hip prosthesis is likely to refer to a restricted representation, and this will still need prior TGA approval. And of course, the prohibition on advertising prescription medicines to consumers is still in play. So there is a detailed discussion on these issues in the consultation paper. And to summarise, we are seeking feedback from stakeholders on two main things. One, whether they would support the use of the new mandatory statements in the circumstances described. And two, what form of words best conveys the message. I'll just see if there are any questions on this particular item.
So the question is, if the ad is only targeting clinicians, does this apply?
I'll take that question. So if the advertising is targeting clinicians, but it is still in the public domain, meaning it's accessible by the public without any sort of security, then yes, this would apply. This requirement would apply.
Thank you. Sorry, everyone, I'm still having trouble advancing these slides. There we go. Okay, so moving on to section 12. So like section 11, section 12 also sets out requirements for the use of mandatory statements. Section 12 mandatory statements are required in advertisements for products that are not available for physical examination at the point of purchase. For example, when purchased through an online store. And if the products being advertised have health warnings, section 12 requires information in relation to the health warnings to also be included in the advertisement, in addition to the mandatory statements. The two issues most often raised about section 12 are the amount of advertising space that the mandatory statements and health warnings can take up, and that is unclear how advertisers should include information about health warnings in the ad. Health warning information is crucial to consumer safety and is relevant to all types of therapeutic goods. And if you focus on medicines, for example, the health warnings can alert consumers to when the use of the medicine is contraindicated. For example, the health warnings could be that the medicine should not be taken by someone who is pregnant or breastfeeding, has a particular pre-existing medical condition, or is allergic to an ingredient of that medicine. So Section 12 requires advertisers to bring relevant warnings to the attention of consumers, both through the advertisement and before the consumer purchases the product. So the consultation paper canvasses two options to assist advertisers meet these obligations. The first proposes that where an advertisement is genuinely limited by physical space or character count, such as on a mobile-friendly website that sells therapeutic goods, the mandatory statement, "This medicine may not be right for you," should be prominently displayed in the ad, with the health warnings available by clicking on a prominently displayed and appropriately named link, such as "Click here for important health warnings." The second option is to allow an image of the label of the product to convey the health warnings in the ad. The mandatory statement would be, "This medicine may not be right for you. Read the warnings before purchase," with consumers alerted to the image of the label in the advertisement to see the important health warnings. So again, there is a detailed discussion on these issues in the consultation paper. And in summary, we are seeking feedback from stakeholders on whether either or both the proposed options would assist advertisers and still ensure that consumers are effectively alerted to the health warnings before they purchase the goods. So no questions immediately on that issue. So we'll move to section 13. And section 13, as we've said, also sets out requirements for the use of mandatory statements. And section 13 requirements apply to all advertisements not otherwise subject to either section 11 or section 12. So the section 13 mandatory statements alert consumers to always read the label or instructions for use as applicable to the product type. And when the product has health warnings, section 13 requires a statement that either warns consumers that this medicine or product may not be right for them, in addition to read the label before purchase, or alternatively, alerts consumers to always read the label or instructions for use, in addition to reproducing the actual health warnings for that product in the advertisement. The issues raised about section 13 are similar to those for section 12. That is, there's a lot of mandatory information required in an ad, and this can create an issue for ads that are limited by character count or duration. Now, one suggestion in this regard is that an existing exemption provided under paragraph 5 of section 13 of the code should be available more broadly. So presently, this exemption removes the obligation to include some mandatory statements in radio ads that are 15 seconds or less in duration, or in text-only ads of 300 character counts or less. Now, at the moment, this suggestion is not supported at this time, because under section 13, there is actually no mandatory requirement to reproduce the health warnings in the advertisement. Advertisers do have the option just to alert consumers that the product may not be right for them and prompt them to read the label or instructions for use before purchase. So because section 13 covers advertisements for goods that can be examined at the point of sale, for example, through a bricks and mortar retail outlet, consumers will be able to read the health warnings on the label of the goods before purchase. So we haven't sought views on this position through the consultation paper, But nevertheless, stakeholders are welcome to cover this or any alternative proposals relevant to Section 13 if they wish in their submissions. And finally, a discussion on the wording of the mandatory statements. So stakeholders have raised other issues about the mandatory statements, including that if there is more than one mandatory statement required by sections 12 or 13, could these be combined to reduce the amount of advertising space needed? Can there be a grouped mandatory statement for use under section 13 when multiple products are included in the same ad, so as to avoid including multiple statements that in general terms deliver the same messaging? And are the symptom statements required by sections 12 and 13 effective at helping consumers determine whether the advertised product is right for them? So when we considered the question about combining mandatory statements or coming up with replacement mandatory statements that take up less advertised space, but are otherwise still effective for the required messaging, we didn't come up with anything particularly innovative that we thought was an improvement on the existing statements. This is because the existing mandatory statements are already concise, and the overseas approaches that we looked into also didn't significantly improve on what we already have. So we would welcome suggestions from stakeholders about how the mandatory statements could be improved. The consultation paper does propose a significant change to the mandatory statement prescribed under subsection 13(2)(a) of the code, which is used when an advertisement relates to more than one medicine and at least one of those medicines requires a health warning. Stakeholders have suggested that this combined statement be expanded to cover an advertisement that relates to more than one product rather than just more than one medicine, and at least one of those products requires a health warning. So we have an example of an ad that includes a number of medicines and a medical device in the same ad. And you can see there that the warning statements, the mandatory statements, are repeated for each product. So what we might, how the new mandatory combined statement might be able to be used is that we could have the general statement, these medical products may not be right for you. Read the label and instructions before purchase, rather than reproducing that statement for each item included in the ad. So it would be important to note that the combined mandatory statement would only replace other section 13 mandatory statements. So other mandatory statements required by other parts of the code would still need to be included. For example, if the advertisement included an analgesic medicine, the mandatory statement required by section 24 of the code, which is incorrect use, could be harmful, would still be required. And the final issue about mandatory statements is in relation to the symptom statements. So there are two symptom statements that may be required in an ad that includes a claim relating to a symptom of a disease or condition. When both statements are relevant, the code already provides for them to be shortened and combined to avoid duplication. Further, these are generally not required radio advertisements, 15 seconds or less, or in text-only advertisements of 300 characters or less. We are seeking stakeholder views generally about the symptom statements. The may wish to advocate, for example, that the symptom statements are not necessary in an advertisement because they don't influence a consumer's decision to purchase a product. Alternatively, you may support retaining the symptom statements because they prompt consumers to think about whether they should seek the advice of a health professional in the first instance, rather than trying the advertised product. Or you may consider that the symptom statement should be retained because they prompt consumers to seek health professional advice before trying a repeat treatment with the advertised product. So to summarize, please use the guiding questions in the consultation paper to give us your views on whether the wording and use of the mandatory statements could be improved. Just check, see if we have any questions on those sections. Yes, we do.
The question relates to section 13. It says, if section 13 already needs a statement, always read the label. Why is it necessary to also include this medicine may not be right for you? Do you think this extra statement in an advertisement where the consumer has access to the label before purchase will influence the consumer's purchase decision?
I'm happy to reply to that one. So the intention of the statement, this medicine may not be right for you, is to alert consumers that there are specific situations in which the use of the medicine or other type of therapeutic good, where relevant, has, for example, contraindications where it must not, absolutely must not be used in certain situations because of the potential for deleterious effects. So it's intended to convey that there's an extra level of attention, I guess, needed to establish whether or not the medicine is appropriate for that person, which may not be necessary in cases for medicines that don't have health warnings. And the general warnings, you know, included on the pack may just be, for example, related to, you know, don't take too much of it, see your doctor if symptoms persist beyond 3 days, those sorts of things. So they're not absolute showstoppers for a consumer in terms of purchasing the medicine. So that's why there is a difference between those two.
Okay, thank you, Leanne. Apologies. Okay, so the next issue we will cover concerns health warnings for medicines. Presently, Schedule 1 to the code lists the health warnings for medicines that contain an ingredient included in the schedule. So these health warnings must be brought to the attention of consumers when these medicines are advertised, either by stating that the medicine may not be right for everyone and directing consumers to read the label, or reproducing the health warnings from Schedule 1 in the advertisement. The health warnings in Schedule 1 reflect the warnings included on the medicine label. So users of the code have identified a number of issues with Schedule 1, including that the process of identifying the relevant health warnings to include in an ad is complex. The TGA has also identified that the process of keeping Schedule 1 up to date is resource intensive. And that's because there are a number of legal instruments from which the health warning statements are derived. These instruments are regularly updated, requiring Schedule 1 to be regularly checked and updated to ensure it remains current. And each time Schedule 1 is updated, a new code needs to be made. So the proposal in the consultation paper is to replace Schedule 1 with a process that advertisers can use to identify the required health warnings for the medicines being advertised. So the process would involve interrogating the label of the medicine for warnings that are required for the relevant labelling instrument, and then determining whether the warnings are of a type that need to be included in an advertisement of that medicine. Once it is determined that there are relevant health warnings, a three-step process would be applied to determine what the health warning statements needed to be included in the ad are. So those three steps are up on the screen now. I think they're fairly self-explanatory. If you look in the consultation paper, we've stepped out a number of different types of warnings in tables. And the first step would be to check the label of the medicine to see if it includes a health warning of a type similar to those listed in the new table 1. If there is a warning on the label of the medicine which matches a warning in table 1, then that warning needs to be included in the ad. Step 2, check the label of the medicine to see if there are any specific health warnings applicable to the advertised product. So these are warnings specific to certain ingredients. And then step 3 is to check the label of the medicine for health warnings when a medicine contains a substance known to cause an allergic reaction or is otherwise contraindicated for use in susceptible individuals. So to date, we've received mixed feedback on this proposal. Some have told us the process looks straightforward and will make it easier for advertisers to identify the required health warnings. For others, the process needs further elaboration. So I've added a few slides on a made-up ibuprofen product to illustrate how the new process would work. So our example product has a number of warnings and advisory statements as shown. To convert, and this is shown on the warning panel of the product itself. To convert these into health warnings for the purpose of an advertisement, we would apply the three-step process. So we start with table 1, and in the first instance, check if there are any pre-existing medical conditions that are contraindications for the use of this medicine. So we can see that stomach ulcers, impaired kidney function, heart failure, and allergy to ibuprofen or other inflammatory medicines from table 1 match the contraindications included on the label. So these are relevant health warnings to include in the ad. So next we look for any advisory statements in relation to pregnancy and breastfeeding. So there is one absolute contraindication, which is do not use during the last 3 months of pregnancy. And there are 2 circumstances where health professional advice is recommended in relation to pregnancy and the use of the product. So they are, do not use if you are trying to become pregnant or during the first 6 months of pregnancy, except on the advice of a health professional. So these would be added to the advertisement. The label has other advisory statements in relation to the use of the product that are subject to being directed by a doctor. These correspond to health warning statements in table 1 under the heading Seek Medical Advice. So the required health warning for the advertisement would be talk to your health professional before use if you have asthma, are taking other products containing aspirin or anti-inflammatory medicines, or are aged 65 years or over. So we've now accounted for all of relevant advisory statements on the label for which there is a corresponding health warning in table 1. Moving to table 2, we can see that there are no specific health warnings applicable because our product doesn't contain the substances included in Table 2. So Table 2 doesn't apply in this instance. And moving to Table 3, there is one relevant ingredient warning. So our ibuprofen product contains lactose. So Section 12 ads for this product would require the health warning from Table 3 contains lactose. And if there was a significant amount of lactose that would potentially cause a glycemic effect, the Section 12 ad would also need to carry the warning contains sugars. To complete the process for identifying the health warnings, we have to consider whether our ad needs to comply with Section 12 or Section 13 of the Code. For Section 12 ads, the health warnings must appear somewhere in the ad with the required mandatory statements. For Section 13 ads, there is an option to either include the health warnings in the ad with the mandatory statement, always read the label, or include only the mandatory statements. This medicine may not be right for you, read the label before purchase. And note that the substance warnings from Table 3 are not required for ads covered by Section 13. So our Section 12 ad would look like this. So it's clear that it's available for an online purchase through the advertisement. It has the required mandatory statements, and it has required health warnings, including the lactose ingredient warning. Our Section 13 ad would look like this if the advertiser chose to include the health warnings in the ad. So it's available for purchase from a pharmacy, and it has the same mandatory statements and health warnings as the Section 12 ad, but without the lactose warning. So I hope this run through with our example product clarifies how we would intend this process to work. But before we leave this topic, I just want to explain what the asterisk against asthma on this slide means. When we went through the process, comparing the advisory statements on the label of our product with the corresponding health warning statements in Table 1 of the proposed new process, we realised that we didn't have a corresponding entry for talk to your health professional before use if you have asthma. So while we consider that advertisers and sponsors ought to be able to determine for themselves what the required health warnings are for an advertisement based on the label of the product, the process we have proposed for this to occur isn't at this time and in its present form going to be 100% reliable. So to summarise, we are looking to stakeholders to provide us feedback on this proposed process that will help us to identify issues such as this and refine how the process could work in practice. Just check to see if we have any questions. Right. So we'll move on to the next issue. So possibly the most significant of the proposed changes to the code are to requirements for endorsements and testimonials. So the proposals include minor adjustments to who can provide an endorsement and clarification of some of the existing requirements. For example, reiterating that any health benefit claims made about a product in a testimonial or an endorsement must be consistent with a product's indications or intended use included on the ARTG entry. The requirement to verify the details of a person giving a testimonial, and that paid testimonials are considered marketing and so are not permitted. There are also a number of more significant changes proposed, and these are set out in the consultation paper as 3 options. So option 1 largely replicates the existing code requirements for endorsements and testimonials with clarifications. So we've included a plain English outline of the proposed new provision in the consultation paper. And this side sets out the main clarifications. So that advertising of health benefits inconsistent with indications or instructions through testimonials or endorsements is prohibited. The requirements to verify the details of testimonial providers, and that paid testimonials are considered marketing and not permitted. Option 2 builds on option 1 with some additional changes. In option 2, persons involved in the marketing of therapeutic goods, including brand ambassadors, would be permitted to provide testimonials, and family members of those involved in the manufacture or supply of the therapeutic goods would also be permitted to provide testimonials. Option 2 would introduce some new mandatory statements for when a testimonial is used in an advertisement. Those are the statement, testimonials may not be reliable in determining whether a product is appropriate for others, and this would be required for all testimonials. The statement, this is a paid testimonial, would be required when the person providing the testimonial receives payment or other valuable consideration. And the statement, this testimonial has been provided by a family member of someone involved in the manufacture or supply of this product, would be required for testimonials provided by relevant family members. And finally, option 3 would build on option 2 with one additional change. In option 3, direct sellers would be permitted to use their own testimonials in an advertisement with a further mandatory statement, which is, I benefit from the sale of these goods. We've done a mock-up of a Facebook post from Sally Seller where we've included the proposed new mandatories. So in this particular ad, the relevant mandatory statements would be testimonials may not be reliable in determining whether a product is appropriate for others. I benefit from the sale of these goods. And then the existing mandatories, always read the label, follow the directions for use. So to summarise, we are seeking feedback on the 3 proposed options. And we are also open to alternative suggestions. For example, when the different options set out in the consultation paper are only partially supported. Just check to see if there are any questions.
So there was a question regarding asking for clarity on the statement of use and including that on the definition
of testimonials. And so I interpret this question to mean in terms of the current code, it states that for the purposes of the testimonial requirements, a testimonial means a statement about a therapeutic good made by a person that claims to have used that good. So what we're referring to there is that in an advertisement for a therapeutic good or a testimonial that constitutes an advertisement for therapeutic goods, that actual advertisement identifies the person as claiming to have used that good whether it's used in a personal sense, like on their own being, or used in relation to someone that they have family responsibilities for example, your children, or caring for perhaps elderly parents. It doesn't extend to, for example, people that are using therapeutic goods in relation to others as part of their job. For example, if you were a nurse and you used particular bandages as part of your job in relation to patients, and you made a testimonial or put a public statement out about those bandages, that you've used them and think they're great, then it would not constitute a testimonial because you're not using the goods personally. That situation would also be a prohibited endorsement, by the way, because it is a health professional. So that would be prohibited under Section 16. I hope that helps to clarify.
We've also got a question on social media posts. Social media posts are usually collapsed so that those mandatory statements would not be visible unless see more is clicked. Is this acceptable for prominently displayed? That also seems to be a question regarding current code provisions.
Sorry, bear with me while I juggle my screens and look for the current code. So the code defines prominently displayed or communicated as, in terms of a visual statement, standing out so as to be easily read from a reasonable viewing distance for the particular media type in the context in which the advertisement is intended to be viewed, or for a spoken statement able to be heard clearly and understood and repeated as often as is necessary to ensure that it is likely to be noticeable for a viewer or listener. In the situation where the mandatories end up hidden and the viewer has to click on something to read more content and then find the mandatories, we would not consider that to comply with the requirement to be prominently displayed or communicated. The concern there is that the content that the viewer can see without clicking might be enough to persuade them to seek out the product without having been exposed to the mandatory statements that are there to protect them. Graham did talk about an option earlier in relation to advertisements, for example, on online stores, where it might be possible to draw a consumer's attention to the fact that there are mandatory statements by saying, you know, click here for important health warnings. And we're seeking comments on whether that would be acceptable. But for a standard social media post, it would not be acceptable currently under the current code. You would need to ensure that the mandatory statements appear and are prominently displayed or communicated without the user having to click on something to find them or stumble across them.
Thank you, Leanne. We'll keep going, noting that there is going to be time at the end for further questions. So the final section that I would like to discuss is section 20. So section 20 prohibits the offer of free samples to promote a therapeutic good, unless that therapeutic good is of a type included in Schedule 3 to the code. So goods not included in Schedule 3 cannot be offered as free samples, and any promotion of a therapeutic good not in Schedule 3 via the offer of a sample, except by a health professional in the course of providing health advice or treatment, would breach the code. So there are two proposals in the consultation paper in relation to Section 20 and Schedule 3. The proposal for Section 20 is to make an amendment to the provision to specify that both the offer and provision of a sample of a therapeutic good, not of a type included in Schedule 3, is prohibited. Now that's just a clarification because I understand the current provision only prohibits the offer of a sample. But the provision of a sample can in and of itself be considered an advertisement, so that would also be prohibited. In relation to Schedule 3, some stakeholders have asked that other types of goods be added to the schedule. Through the consultation, we are seeking views on both proposals. In particular, on whether there is support for new types of products to be added to the schedule, and whether an application and assessment process for the inclusion of new types of goods in Schedule 3 would be appropriate. In the consultation paper, there are proposed guiding principles that would guide the selection of new types of products for inclusion in the schedule. So to summarise, we are looking for stakeholder feedback on whether to allow new types of goods to be added to Schedule 3 and whether the proposed guiding principles set out in the consultation paper are appropriate. Just see if we have any questions on Section 20 and Schedule 3.
So we have been asked, Graham, about whether the TGA regards consumers receiving products based on reward points to be samples if the consumer is able to actually select the products that they receive. I think we might take that one on notice and follow up with a written response to that one.
Well, thank you, everyone. That concludes my presentation. I might just hand back now to Leanne to summarise the next steps, and then we'll take some questions.
Thanks, Graham. So, as I mentioned earlier, this public consultation closes on the 18th of June, which is 2 weeks tomorrow. Once the consultation closes, we will go through the process of assessing all the submissions that we have received and the feedback that we've received through those submissions. And based on that, we will consider what changes we should be recommending be made to the code. And as part of that, we'll draft what we call legislative drafting instructions. That will mean that we can actually engage legislative drafters to draft a new code or changes to the existing code. That draft code will then be the subject of further consultation with TGACC. There's a meeting at the end of July where we will present that code as well as a summary of the outcomes of the public consultation. Once we have, I guess, a relatively stabilised view of what changes are likely to be made to the code, then we will start the process of preparing updated guidance to go on the TGA website to support that new code. And we will also start communicating with stakeholders about our progress in relation to the new code and what arrangements are going to be made for its implementation. Around the same time, we will also put our recommendation to the Deputy Secretary of the TGA to consider the proposals to amend the code. And if that's agreeable, then the code will be made. As part of that process, we'll also formulate a plan for conducting training for stakeholders, and the format's likely to include both webinars and face-to-face sessions. So that's about it in terms of the next steps. If you have specific questions that you haven't raised through the Q&A section here today, you can email us afterwards at advertising.consultation@tga.gov.au. In a moment, we'll bring up a slide that has some useful website links for you, including links to the consultation itself and the current guidance that we have published around the current advertising rules, which can all be found in the Advertising Hub. The first question that we will respond to asks about the consultation paper, talks about advertisements for health professionals only on social media should be restricted to health professionals only. However, social media platforms such as LinkedIn do not have features for limited access. What is the TGA's expectation here if the LinkedIn post has disclaimers? So, as I mentioned earlier, if an advertisement is publicly accessible, meaning consumers can access it, then it needs to comply with all of the applicable consumer advertising requirements, and that includes the mandatory statements. We do recognise in some situations the current mandatory statements under the code may not always be fit for purpose, and Graham talked through some examples. So for things like hospital drapes, for example, that can only be purchased by health professionals or those working in hospitals or medical centres, it may not make sense to promote those goods with the statement, you know, always read the label. And that's why we're exploring whether there is a need for an alternative mandatory statement. However, if you feel that an advertisement that you want to direct to a health professional cohort cannot be exclusively directed to health professionals, it will need to comply with the code. Similarly, if you are concerned that you cannot reasonably make the advertisement comply with the code, then it shouldn't be in the public domain.
Are free samples to clinicians acceptable, is the question.
Thank you. So if the clinician is captured under section 42AA of the Act, meaning that they are a health professional in terms of the advertising rules, then yes, it is acceptable to give samples to clinicians. Those clinicians can in turn use samples to give to their patients as part of a course of treatment or consultation with that patient.
And in a similar sort of vein, I guess, if the piece is educational and targeted to HCPs, do we need to restrict access to general public? If yes, what is the preferred way?
Good question. So if the piece is educational and would not be considered to meet the definition of advertise as set out in the Act, then it's not necessary to restrict access. The definition of advertise basically comes down to any statement, pictorial representation or design, however made, that would promote the use or supply of the goods. So you need to put yourself in the shoe of a consumer that would be looking at this content to establish whether they would likely be persuaded to either seek out that good to use it or seek out that good from a particular supplier. If that's the case, then it would be advertising, and it would need to be restricted to health professionals only, or otherwise comply with the consumer advertising requirements. In terms of restricting access to content online, probably the gold standard way is to have a firewall that would require someone, a health professional, to pre-register to be able to access the material, and there is some kind of validation behind the scenes that they are indeed a health professional. That validation could be done manually, although I think there are ways to do it based on APRA information. But that's the gold standard. There is a fact sheet on the TGA website that sets out, different ways that it might be achieved.
This question relates to social media. If the overseas legal manufacturer of devices releases a post on social media and a local subsidiary in Australia reposts it or likes it, is this considered as non-compliance?
Oh, good question. So certainly if the local company reposts it and the post is advertising, it would need to comply with the Australian advertising legislation, including the mandatory statements. So unless the overseas manufacturer has constructed the post in order to comply with our rules, it is likely to be considered non-compliant. In terms of just liking the post, it's a little bit tricky. I think depending on the social media platform, that could trigger, people that are following the local company on that social media platform. It could then make that post visible in their feed, and I think that would also be considered non-compliant. But I think that one might depend on the social media platform. So we have another question here about social media, just commenting on the social media mock-up that we showed in one of our slides, and commented that because of the length of these health warnings, it's possible that even if you started the post with these warnings, they may not all immediately be visible. That's something that you as an advertiser are responsible for ensuring the compliance of the post. And that may mean that you need to understand the intricacies of each social media platform that you're dealing with, and what the best way is for each to make sure that you comply with the requirements. So, for example, it may not be possible to get the mandatory statements into the text, but it might be feasible to put it in, say, a photo that pops up with the text, or an image that pops up with the text. The code stops short of prescribing, I guess, what must be included in a particular advertisement based on whether it's social media or a newspaper ad, because we do want to give advertisers flexibility in how they create their ads, which is why the concept of prominently displayed and communicated has been crafted the way it is, to give you the maximum flexibility in constructing your advertisement. So as long as you meet that requirement, how you choose to meet it, is up to you.
We have another question on samples. Can a company supply samples, non-scheduled general sale therapeutic goods to pharmacy shop assistants and for pharmacy shop assistants to give away samples, e.g. at the checkout?
That's an interesting question. If the good is listed in Schedule 3, then yes, that's certainly acceptable. It's important to remember that shop assistants, even in a pharmacy, are not considered health professionals. So their discussion with the patient is not necessarily considered exempt from the consumer advertising requirements. It may be a professional practice issue if the pharmacist is involved, but if a pharmacy shop assistant is at the checkout giving away samples indiscriminately, it's hard to argue that it is part of, that professional practice aspect. So I think this would, I would approach this with absolute caution. There's another question here about whether gift vouchers or discount codes fall outside of the samples requirements in the code. Discount codes, yes, certainly. If it's just a straight discount code, get $5 off your next purchase of insert therapeutic good here. With this code, when you shop online, that's not an issue. Gift vouchers, probably a little bit trickier. And I think there are situations where it probably would fall foul of the samples requirements. We probably need a bit more information to be able to advise you on that one. So you're welcome to contact us with that question with a bit more information after the event if necessary.
There's a question. Would you consider guidance on how long mandatory statements must be visible for on a TV or cinematic broadcast advertisement?
That's another good question. So we don't provide guidance on how long the statements must be visible for in TV or cinema ads. I believe that under the AANA code, I think there are guidelines under that about, recommendations about how long they should be visible. But we've stopped short of going that far. So it will come down to whether the duration will meet the requirement for prominently displayed or communicated. Probably a good rule of thumb is if a consumer has watched a TV ad and hasn't retained the fact that there were mandatory statements and what they said after the advertisement, then it's probably a pretty good indication that it's not long enough or it's not prominent enough in terms of, font size and things like that.
Leanne, I think you covered this partially in your wrap-up, but the question is regarding our plans to conduct training sessions in the near future for people who are super new to therapeutic goods advertising rules and are now required to understand them as part of their role.
Sure. So I did talk about training for any changes that we intend or are going to make to the code. From the questions we've received in this webinar and also the previous webinar, it's clear that people are needing some basics training, and we will look into setting up a basics webinar. There are other organisations though around the place that are doing or may do training that may suit you as well, so you may wish to look into that. Any training that we do, we will publish on the TGA website, so people can register and make plans for that. Sorry, I had another thought and it's completely escaped me. So yes, we'll look into that. So we have had some questions around the transition period in relation to the code. I can't comment on that at this stage, except to acknowledge that it is a consideration, an important consideration for advertisers, and that there will be further consideration given to what's needed in terms of a transition period.
Okay, I think we're going to finish it up there, everyone. Thank you all for your questions. Just going to go back to some of the social media slides and references, link references there for you to have a look at. But again, I just want to thank Leanne, Graham and Helen for the information session, and that the slides will be made available on the TGA website. Thank you, everyone.